This is my presentation over Hodgkin's lymphoma. Hodgkin's lymphoma is a malignancy of the lymph nodes that originates in a single lymph node or a single chain of nodes. In lymphoma, or Hodgkin's lymphoma, neoplastic cells are called Reed-Steinberg cells. These cells attack the immune cells or the white blood cells. And here's a picture of it. Hodgkin's lymphoma is categorized into 4 types. The first one is nodule sclerosing Hodgkin's lymphoma, NSHL. The second one is mixed cellularity Hodgkin's lymphoma, NCHL. The third one is lymphocyte depleted Hodgkin's lymphoma, LDHL. The fourth one is lymphocyte-rich classical Hodgkin's lymphoma. The manifestations of Hodgkin's lymphoma is usually found in your spleen, liver, bone marrow, lungs, or mediastinum. The symptoms could include a painless enlargement of lymph nodes, non-productive cough, abdominal pain, a non-tender enlarged movable node, and in the advanced stages you'll have a low-grade or intermittent fever, anorexia, nausea, weight loss, night sweats, or pruritus. And here's a picture of areas where your lymph nodes are and where they could be swollen when you have Hodgkin's lymphoma. Some diagnostic tests that a doctor could order to see for Hodgkin's lymphoma would be chest x-ray, CT scan, positron emission tomography, which is also called PET. For lab draws, you could have a CBC, lactate dehydrogenase, serum creatinine, alkaline phosphatase, testing for HIV, serum levels of cytokine, and soluble. The treatment for Hodgkin's lymphoma is generalized into 4 categories. The first one is radiation therapy, which in the early stages, this is a choice for any mediastinal node involvement, which includes external radiation in the involved lymph node regions. But if it's an extensive stage, or they need to do extensive treatment, they'll do this kind of radiation and multi-drug chemotherapy. The second kind of treatment would be induction of chemotherapy. I have listed 4 different categories of the drugs that are involved in each. The first one is MOP, which is methylchloroamine, vincristine, procarbazine, and prednisone. The second one is ABVD, doxorubicin, bleomycin, vinblastine, darcobenzene. Third one is standard V, which is doxorubicin, vinblastine, mustard, bleomycin, vincristine, etoposide, and prednisone. And then the B cope is bleomycin, etoposide, doxorubicin, cyclophosphamide, vincristine, procarbazine, and prednisone. And then the last 2 treatment types are salvages chemotherapy or hematopoietic stem cell transplant. For education regarding your treatment, there are possible chances of having toxicities associated with them. So you need to tell your parent or your child these, and these toxicities include hematologic toxicity, pulmonary toxicity, which would be with the bleomycin or thorax radiation are used for those, cardiac toxicity, and then infectious, cancer, neurological, and psychiatric. For radiation therapy, there's adverse reactions that are associated with it that you need to make sure you inform your patient about. Those are anorexia, nausea, vomiting, muscular ulcerations, diarrhea, hair loss, dry or moist desquamation, cystitis, cystitis, and myelosuppression. The prognosis for Hodgkin's lymphoma, according to the Hodgkin's lymphoma article I read, the CER data reposed an 86.2% overall 5-year survival rate from 2006 to 2012. They also say it's potentially curable lymphoma depending on this distinct histology, biological behavior, and clinical characteristics. The population that's affected for Hodgkin's lymphoma is early adulthood, especially in people that are in their 20s, and then it rises again in their late adulthood, which is after age 55. It is rare in children younger than 5 years of age. And one major nursing diagnosis with Hodgkin's lymphoma is chronic pain related to a growth tumor, as evidenced by the patient stating they are in pain or rating pain. Interventions you could do is aid the patient impaired about choosing a particular pain management strategy. 2. Allow the patient to decrease appetite or describe appetite, bowel elimination, and ability to rest and sleep. Administer medication and treatments to improve these functions. Maintain the patient's use of non-pharmacological methods to control pain, such as distraction, imagery, relaxation, massage, and heat and cold application. Outcomes for a patient with this nursing diagnosis would be patient states their pain has decreased, patient says they no longer have pain, or the pain is being relieved. So NCLEX question number 1. The doctor is examining a child who is in the office with enlarged non-tender lymph nodes. They think he may have Hodgkin's lymphoma. Which diagnostic test will the doctor order? Which is select all apply. 1. Ultrasound. 2. Chest x-ray. 3. Stress test. 4. CT scanning. 5. Position or PET. Answer 2, 4, and 5. The doctor may order the chest x-ray to see if any lymph nodes in the chest are swollen, and same for the CT scan. The PET scan takes images that are observed metabolically processes in the body. A stress test is used for cardiac issues, and an ultrasound would not show anything. NCLEX question number 2. The nurse is educating the parents of a child diagnosed with Hodgkin's lymphoma and who has started chemotherapy. She is stating all the adverse reactions. Which one would she not include in the teaching? 1. Anorexia. 2. Alopecia. 3. Abdominal pain. 4. Diarrhea. The answer would be 3. Abdominal pain. 3 is not correct because it is a possible sign of Hodgkin's lymphoma, and all the other questions are possible adverse reactions. These are my resources that I found all this information at.